The occurrence of brain metastases in both non-small cell lung cancer and small cell lung cancer is very high. Probably upwards of 50% of patients would, in the course of their disease, develop brain metastases. So, you know, there's been studies in small cell lung cancer that have shown that it definitely reduces the probability of brain metastases to do prophylactic renal radiation. But it took the combining of many studies together to really get a statistically significant figure that it definitely improves, but by a small amount, approximately 5%, that it improves the survival at 3 years. So, you know, a small overall benefit to survival, a significant decrease in brain metastases, certainly worth discussing with the patient. In non-small cell lung cancer, there was also a study of prophylactic renal radiation, but that study, it didn't accrue particularly well, so perhaps statistical significance is lacking for that reason, but in any event, it did not improve overall survival in that national study. So it's pretty well, I think, not going to be resurrected. Non-small cell lung cancer prophylactic radiation, I think, is behind us. And also whole brain radiation therapy, even for established brain metastases, is probably declining in use as people are getting more interested in local treatments, primarily radiosurgery. A few patients will have surgery to remove them, but they have to be usually solitary or symptomatic for that to be the usual recommendation. So radiosurgery is a way of just treating the metastasis, and hopefully, you know, that will give the patient some benefit. Well, it does. I think on average, it is very high local control. But it doesn't prevent new metastases from coming when you just treat the existing metastases. So these patients still have to be kept under general surveillance with MRIs. So, you know, I think whole brain radiation therapy, it still has its place, but it's become more controversial in the last few years.